Alice, and I decided to do my cardiac 2 presentation on coronary artery disease for Grand Canyon University for the class of Concepts of Human Physiology 2. So just a little background on coronary artery disease. It is one of the most common heart diseases in the United States of America. Two other common names are coronary heart disease and ischemia heart disease. So kind of just like the causes. So one of the primary causes is plaque buildup. That's due to the buildup of cholesterol within the coronary arteries. This causes narrowing of the arteries, which leads to decreased blood flow to the heart or other organs of the body. Some of the symptoms of coronary artery disease are angina, which is just chest pain or discomfort. Most of the time people don't realize that they have coronary artery disease until they have a heart attack. That's the most common first sign that people go and get checked and they realize like, oh, I have CAD. Other symptoms are weakness, shortness of breath, lightheadedness, and cold sweats. Some of the risk factors of coronary artery disease come from, or developing coronary artery disease come from being overweight, smoking tobacco, unhealthy eating, not being physically active at all, and also if you have a family history of CAD, then you have a higher chance of developing it, especially if you're over 50. So in order to diagnose CAPD, there's a couple of different ways that doctors choose to go about it. One of the ways is the EKG, which EKG just measures the electrical activity rate and regularity of the heartbeat. Then there's the exercise stress test, which is basically they put you on a treadmill and they monitor your heart rate. They'll speed you up and slow you down and kind of just see if your heart is pumping efficiently. A chest x-ray, which basically just takes a picture of your heart, lungs, and the other organs in your chest so that they can see what's going on in there. A cardiac catheterization, that is where they look inside of your arteries for a blockage. They insert a thin flexible tube either in the arm, the neck, or the groin, and they insert it to the heart, and they just see if you have any blockages leading to the heart. And then the last one is a coronary angiogram. The coronary angiogram is basically where they inject dye into the body, and then they take an X-ray and they monitor for blockages and the flow of blood to see how efficiently your blood is flowing, or if there's a decrease in blood flow, then that'll kind of give them an idea that that area is where a blockage is. So how to improve the chances of not getting or maintaining coronary artery disease. So of course, physical activity, which that will lead me into my article that I chose to focus on to tie into this. So just exercising will help, of course, making sure the heart is pumping, the blood is flowing. Counseling will help decrease your stress and increase your mental mental health. So sometimes stress leads to a whole bunch of other things. It can lead to unhealthy eating habits because you're stress eating. You're stressed out, so you're not working out or doing your normal day-to-day activities. Of course, mental health can be a detriment as well. You maybe might not have the energy or the mental capacity to get up and exercise or whatever the case may be. Education, when I say education, I just mean educating you on a healthy lifestyle, what it takes to, what a healthy lifestyle looks like as far as eating right, exercising, and just taking care of yourself, maybe taking daily vitamins if that's something that was necessary, and just being more aware of making a lifestyle change to better yourself in the future. Medicine, sometimes medicine is given to basically lower blood pressure and lower cholesterol. I know my dad has high cholesterol and high blood pressure, so he does take medicine for both. So medication can be given, and also they can educate you on the proper ways to take that medication to ensure that it is the most effective. And then, of course, there is surgery. And with surgery, they just basically do that in order to restore the blood flow to your heart. Most of the time, they don't do surgery unless it's a complete blockage. And it's just absolutely necessary. When it's not a complete blockage, they try to use medications and other forms to lessen the effects or help with that. So back to physical activity. With the physical, so the article I chose to focus on, based on physical activity, just observed the effects of physical activity in men that already have coronary artery disease. So ultimately, at the end, they did see an improvement. There was a total of 81 men. Ranges were from 33 to 83 years old, with 60 being the median age. There was a higher level of obesity in the younger males. However, ultimately, like I said, they did see an improvement of the effects of CAD once they implemented exercise into their daily routine. So in order to kind of get this information, they monitored body mass index, and that was so they can monitor the plasma triglyceride concentrations. They used body weights for the plasma HDL-C concentrations, and they did notice that the younger males had a greater improvement of the HDL-C concentrations from exercising than the older males. However, overall, like I stated, it was an improvement amongst both groups. Now, they did also observe that body weight, body mass index, and fat mass were the better factors to use in order to detect coronary artery disease. So with that being said, I personally agree with implementing physical activity. I know exercise is good for you. It helps you, of course, bring down your body fat percentage, which can then your heart won't have to work as hard to pump the blood through your body. Also, if you are exercising on a regular, your heart is used to doing that, that hard work. It's just normal. So it's not like you're going from doing absolutely nothing to working out like crazy. So then you're putting all the stress on your heart. Having a daily exercise routine is definitely vital. Also, that eating healthy, um, eating less fats, and like just eating healthier, more vegetables, things that don't have cholesterol in them, because you know that cholesterol causes that plaque buildup, which then causes the CAD. So just exercising, implementing that healthy lifestyle. I personally lost a lot of weight. I used to be 170 pounds. I am now 135 pounds. So I can just feel the difference just exercising, being lighter. I feel healthier. I feel like I can do more, get more stuff done. I don't feel as heavy. So, yeah. And then this is just my reference that I use. This is the reference to the journal the journal article that I chose to kind of just discuss and reflect and go